When your doctor says the devastating words, "You have a brain tumor," it can feel impossible to think about what to do next. Discovering a tumor is the first step on the path of treatment. But brain tumors are complex. There are many types of tumors and many types of treatments. Treating a tumor without fully understanding its biomarkers can make the difference between an effective, targeted treatment and a missed opportunity, so it's essential to get an accurate diagnosis right away. It's critical to understand what it takes to arrive at the right diagnosis. So let's take a closer look at how it all works. For most brain tumors, a neurosurgeon removes tumor tissue via surgery or biopsy for testing. Next, a pathologist analyzes the tumor tissue under a microscope to identify tumor type and grade based on what the cells look like and how they're arranged. For example, a more disorganized arrangement may indicate a higher grade tumor. But is that really enough to fully understand what's going on inside the tumor and how it's likely to evolve? Looking at the tumor under a microscope gives doctors a good idea of what the tumor is, but it has its limitations. For example, 2 brain tumors can appear to be the same tumor type under a microscope to even a trained medical professional's eye. Yet, they can actually be different tumor types when examined at a molecular level. Similarly, some brain tumors may initially appear low-grade, but may in reality be a high-grade tumor, misleadingly presenting as less aggressive than they actually are. Looking at the tumor, even through a microscope, can only tell you so much. Fortunately, there's a way to get a closer look. Doctors can send tumor tissue to specialized labs for advanced molecular profiling, known as biomarker testing, to identify the tumor's biomarkers, or its molecular characteristics, its genes, proteins, and other biological data, so that doctors have as much information as possible about the patient's tumor. Recent advances in the field have led to new brain tumor classifications, and biomarker testing can help to determine a patient's integrated diagnosis, which includes the tumor type, grade, and molecular features of the tumor. Understanding the tumor at a molecular level can help shed light on treatment options that may be available to the patient, as doctors can better predict how a tumor will respond to treatment. A tumor's molecular makeup may open up an opportunity for a cutting-edge clinical trial or exclude the patient from a trial that wouldn't work with their mutations. All of this can make a real difference in treatment outcomes and ensure adherence to the latest medical guidelines. Yet, many patients with brain tumors do not understand what biomarker testing is and whether biomarker testing has been performed on their tumor. But what if we could provide the missing pieces to help you make informed decisions about your treatment options? That's why the National Brain Tumor Society launched the MyTumorID campaign with support from affiliate partners to educate patients and caregivers about the importance of biomarker testing and clinical trials. As researchers race toward the breakthroughs ahead, more targeted treatment options are becoming available, and knowing one's complete diagnosis can help guide future therapy decisions. Because when patients know their tumor's biomarkers and treatment options, they are empowered to make the most informed decisions about their treatment. To sign up and learn more, visit mytumorid.org.